video because I told you in the office that you have femoral acetabular impingement, also known as FAI, or labral tears. I described things to you in the office, but I'm sure I spoke too quickly, and so this is just to reinforce what I said to you. Femoral acetabular impingement is a problem where bones grow. So similar to the shoulder, the bone gets increased in size and it causes pinching in the hip. In the hip, there is a ball and socket joint similar to the shoulder. However, the bone is more covering the femur. And so with that, you sometimes grow even more bone, and so it limits your mobility. Oftentimes you'll feel that you can't flex your hip all the way, you can't internally, externally rotate it. They'll give you significant discomfort with any activities like yoga or Pilates. And if that's occurring, we sometimes need to treat it, mostly conservatively, but also surgically. What FAI is the bony bumps, and there are two types of it. There's a cam and pincer bump. A cam bump is when you get the increased bone on the femoral side. So that increased bump, as you go through the range of motion, ends up pinching the labrum. Everyone hears about labral tears in the hip, but really we need to treat the underlying cause. If you just had a labral tear from being an athlete or an athletic event, that's one thing, but the majority of these are secondary to the bony spurs associated with FAI. So once again, the cam side is on the femoral side, and the pincer side is on the acetabular side. We usually, once again, try to treat conservatively, and you can look at my video about the stretching and mobilization program to try and work that through with the physical therapy, and we'll refer you to physical therapy. If you do have a labral tear, oftentimes we try and treat it conservatively, and that is stretching programs like the warrior pose in yoga, and I'll demonstrate that for you in the office, and there'll be a section in the physical therapy videos that you'll see that as well. We try and stretch the capsule so that the capsule can clear better and it doesn't get pinched into the acetabulum as much. So our goal is to, once again, treat you conservatively, but if you need to get your labrum fixed, or if you have a big bony spur that needs to be removed, we do this arthroscopically. We do it at our surgical center. It is through the scope. We go in and we burr down the bone on either side, whichever one is causing the pinching, and then we would either repair or remove the labrum. We prefer to keep your labrum intact if possible, but if it's shredded because of the bony bumps, then we have to remove it. Occasionally we will reconstruct the labrum, taking a piece of allograft tissue and putting it around the labrum to reconstruct the labrum for you. But we will discuss all this individually with you depending on what your symptom complex is.